in the upper extremities, cap-like distribution due to involvement of the anterior wide commissure of the spinothalamic tract with sparing of the dorsal column. Wings expansion results in involvement of other spinal tracts, leading to muscle atrophy and weakness, with decreased muscle tone and impaired reflexes due to damage to lower motor neurons of the anterior horn. Horner syndrome with ptosis, droopy eyelid, miosis, constricted pupil, and anhidrosis, decreased sweating due to disruption of the lateral horn of hypothalamus-spinal tract. Number 2. Poliomyelitis. Damage to the anterior motor horn due to poliovirus infection presents with lower motor neuron signs, flaccid paralysis with muscle atrophy, fasciculations, weakness with decreased muscle tone, impaired reflexes, and negative Babinski sign, down-going toes. Number 3. Wernicke-Hoffmann disease. Inherited degeneration of the anterior motor horn, autosomal recessive, presents as a floppy baby. Death occurs within a few years after birth. Number 4. Amyotrophic lateral sclerosis. Degenerative disorder of upper and lower motor neurons of the corticospinal tract. Anterior motor horn degeneration leads to lower motor neuron signs, flaccid paralysis with muscle atrophy, fasciculations, weakness with decreased muscle tone, impaired reflexes, and negative Babinski sign. Lateral corticospinal tract degeneration leads to upper motor neuron signs, spastic paralysis, and hyperreflexia, increased muscle tone, and positive Babinski sign. Atrophy and weakness of hands is an early sign. Lack of sensory impairment distinguishes ALS from syringomyelia. Most cases are sporadic, arising in middle-aged adults. Zinc copper superoxide dismutase mutation is present in some familial cases, leads to free radical injury in neurons. Number 5. Friedreich ataxia. Degenerative disorder of the cerebellum and spinal cord. Degeneration of the cerebellum leads to ataxia. Degeneration of multiple spinal cord tracts leads to loss of vibratory sense and proprioception, muscle weakness in the lower extremities, and loss of tape tendon reflexes. Autosomal recessive due to expansion of an unstable trinucleotide repeat in the frataxin gene. Frataxin is essential for mitochondrial iron regulation. Frataxin is essential for mitochondrial iron regulation. Loss results in iron buildup with free radical damage. Presents in early childhood. Patients are wheelchair bound within a few years, associated with hypertrophic cardiomyopathy.